My name is Charles Elson. I'm a clinical professor in the Department of Psychiatry, and I'm appointed as a physician educator in the Division of Preventive Medicine, Department of Medicine at the University of Alberta. This session focuses on tobacco in the workplace. Thank you to the Workers' Compensation Board of Alberta for making funding available for this project. There are no conflicts of interest to declare. The opinions expressed reflect those of the speaker and not of any collaborator or funding agency. This session provides a brief overview of the features of the condition of tobacco use disorder and how it impacts the workplace. At the end of the session, participants will be equipped to recognize tobacco addiction as a leading preventable cause of death and disease and outline evidence-based treatment approaches, and also provide a description of workplace approaches to remedy this condition. The cigarette's been described as the deadliest artifact in the history of humankind. Tobacco is the leading preventable cause of death and disease, and the workplace is impacted in a profound way. Smoking has negative impacts, many negative impacts for both employees and employers, including increased healthcare costs, a rate of disability for tobacco-related illnesses, greater levels of absenteeism, decrements in job performance, as well as higher risk for injury at the work site. Fewer than 1 in 5 persons smoke in Canada, and of those who smoke, more than 70% want to quit. 3/4 of persons who are smoking are employed, and this suggests that the workplace may offer a unique opportunity to deliver tailored tobacco cessation interventions, reaching a large number of people at the same time. This can also help minimize many of the costs of tobacco use to employees and employers by offering assistance with quitting and building environmental support for achieving and maintaining cessation. Smoking rates in Canada are at a historical low, and a degree of plateauing may be occurring. However, there are still disparities in the rates of smoking between different groups within the population, and this remains a concern. Smoking exerts a disproportionate toll on people in skilled trade and service-related positions. According to Statistics Canada, these workers experience a significantly higher level of exposure to secondhand smoke at work, and they have greater exposure to workplace toxins that, when combined with tobacco smoke, become even more harmful. Smoking costs the Canadian economy an estimated $18 billion annually, both direct and indirect costs. And there are many health costs specific to the workplace that's associated with smoking. According to the Conference Board of Canada, people who smoke daily were 2.3 times more likely to be unable to work for a period of at least 3 months due to a chronic physical or mental health condition. The loss in productivity related to short-term and long-term disabilities attributable to current or past smoking translated into $7.1 billion in a past study. Employees who smoke or who have quit in the past approximately a decade have 2.4 times more sick days per year than those who have never smoked or who quit more than a decade ago. Millen and co-workers summarized the available evidence, suggesting that this translates into an annual average of $440 in lost revenue to the employer for every employee who smokes. Of interest is the cost to the employer due to persons who smoke taking smoke breaks during the day. Conference Board of Canada suggests that employees typically take 2 unsanctioned cigarette breaks per day, and on average this is 20 minutes per break per cigarette, which is considered significant lost productive time. The term presenteeism, which refers to lost or unproductive time spent in the workplace, costs the employer an average of some $3,800 per year for each full-time employee who smokes. Hence, all things considered, in total and based on costs associated with absenteeism and presenteeism as related to tobacco consumption, the average annual cost to the employer is estimated at $4,200 for every employee who smokes. Smoking, as well as the abstinence from nicotine when people cannot smoke, can have a direct impact on everyday workplace performance and interactions. When employees with tobacco addiction or nicotine dependence are unable to smoke, for example, while at work, they may experience physical and psychological symptoms of withdrawal that can negatively affect workplace performance and behavior. Tobacco use disorder is the DSM-5 term for the description of the condition of tobacco addiction, but another related condition, that being nicotine or tobacco withdrawal, is what happens when the individual remains abstinent, and this features symptoms that may be particularly disruptive in workplace environments. For example, this includes irritability, frustration, anger, anxiety, impaired concentration, restlessness, and low mood. Employees whose jobs require sustained focus often report that impaired concentration is one of the most difficult withdrawal symptoms they have to deal with when they're unable to smoke and they have to abstain. The symptoms that accompany prolonged period of abstinence from tobacco may reduce the productivity and affability of employees who smoke. So what are the benefits of cessation interventions in the workplace? Well, Health Canada suggests that employers who implement tobacco-free policies and offer cessation programs demonstrate a commitment to the health of employees and by extension to that of the general population. Although the primary purpose of a tobacco-free workplace and its policy is to protect people from secondhand smoke and not primarily to get people to quit, they can inevitably also promote and maintain smoking cessation. Workplace smoke-free policies are typically supported not only by individuals who do not smoke, but also by the majority of people who do smoke. And this is likely attributed to the support such policies are able to provide to individuals who wish to cut down or quit smoking tobacco. Remember, more than 70% of persons who smoke want to quit. Workplace programs give access to cessation interventions in a large-scale fashion, and more so than in many other settings. Workplaces can also provide ongoing peer group support and positive reinforcement, and it offers a unique opportunity to reach specific populations, in particular young men, who traditionally have lower rates of using primary care services and thus are less likely to benefit from health promotional activities that occur on primary care level. As most workplaces already have some EAP or equivalent in place or facilitate access to such, it may have easier access to staff to help with the delivery of medical interventions like cessation and to provide professional support. There are, of course, numerous barriers to providing workplace cessation interventions, one of which is that it's perceived as being bad for the bottom line, or the perceived cost may be prohibitive, or there simply exists no institutional appetite to address this public health concern. Although some workplaces are already legally required to be tobacco-free, they do not always provide cessation services. And there's a tendency for employers to focus on mandated occupational health and safety policies rather than on employees' personal health behaviors, such as smoking, even though they may affect health, employee, and productivity. Concerns are, of course, the immediate costs, but when you look at the big picture, within 5 years of introducing a cessation program, there's usually a return of between $3 and $8 for every $1 invested in the cessation program. Workplace cessation programs can be offered on its own or as part of a comprehensive workplace wellness program. Health Canada suggests 3 different approaches that are summarized simply as comprehensive interventions, facilitated interventions, and education and information interventions. And I'd like to encourage you to look at the Health Canada information on this. Clinical interventions, the same tobacco cessation interventions that have been found to be effective in the general population have been found to also succeed in the workplace. And there are no interventions that are unique to workplace settings. A Cochrane review on this topic found that individual counseling, group therapy, and pharmacotherapy, especially nicotine replacement therapy, are the most effective interventions. And the evidence for self-help and social support interventions is less clear. Evidence suggests that incentive-based programs can motivate employees to quit smoking and may improve recruitment into cessation programs. But based on the Cochrane Review, there's not enough evidence to suggest that they increase quit rates. The evidence-based interventions further include the 5A approach, namely ask, advise, assess, assist, and arrange follow-up. And this can be arranged and delivered in a few minutes and fit easily into work schedules in the workplace. And these brief approaches include advising a person to quit smoking, linking them with or providing counseling or cessation medication. And there's a range of these medications available in Canada. More intensive counseling, either group or individually, can also be offered to the individual, and the medication can be facilitated by the attending or treating physician. The approved medications in Canada that are proven to be safe and efficacious include a range of nicotine replacement therapies, bupropion, varenicline, and most recently cytazine. For incentives, well, there's financial and reward-based approaches that may be helpful too and that can easily be implemented in the workplace. There's corporate reward programs, prize contests, gift cards, cash incentives for engaging in comprehensive or facilitated programs, and these are all proven to be of benefit. Tobacco use has many health, economic, and social costs in the workplace. Given the significant amount of time most adults spend at work and the large numbers of people who smoke who are accessible there for cessation, the workplace can be an ideal setting in order and where to deliver tobacco cessation interventions. Workplace cessation programs and supports improve adherence to tobacco-free policies or by ensuring that employees are adequately supported in their attempts to stop smoking tobacco. They remind us that healthcare and occupational health clinicians can help employers to develop and implement these interventions, and that many payoffs, including the improvement in overall health, can be expected. This can result in cutting down on tobacco-related healthcare, disability, as well as insurance costs. Tobacco is a leading preventable cause of death and disease and a major contributor to eventual disability. Tobacco addiction treatment is safe and effective. Tobacco withdrawal can also be occupationally impairing, and this can also be treated. Workplace approaches can have a significant impact. We've included a list of resources which you may find helpful. We look forward to your feedback and comments, and please help us identify further topics for future discussion. Thank you.